So we have each other covered. She is not at any liability. We will be looking at liability once we have a nonprofit formulated, because some prospective board members are already asking questions about what is our liability now that we're in the healthcare world. So we'll be looking into that. But I have All Care and Dr. Burnett has HIV Alliance.
So I'm going to guess, as opposed to like legal insurance where our attorney can decide whether or not he helps somebody legally, if you needed to render aid right now or on a plane or a traffic accident, your medical insurance covers you.
Well, Good Samaritan laws, number one, would cover me. I could do what I'm doing now because I am running from fire to fire, and there are no other health professionals. We don't have any competition, by the way. We are the only ones providing health care to the parks. But yeah, the safety net for me is Good Samaritan law, which if I do something in the best interest that I think of, even if it goes sideways and someone's harmed, I'm still protected. But I have liability no matter where I am.
And are there billable services being provided in the parks?
No, okay. I moved beyond that when I quit private practice, that I'd had it with EMRs and with billing. And so one of the conditions of me working is that at this time, and All Care may change because they're seeing their role grow, and Dr. Burnett is still not here. The issue is they want the service provided, and my license actually cannot allow me to be paid or compensated in any way. That's why it's so cheap. So it works for me really, really well.
Okay, and then you mentioned that there's a van. Who bought that, or how did that come to be?
This was a van that was being released from Josephine County Public Works for having lived a long, hard life. 2011, 14 passengers, transit van frame, 1 ton. And it had hit 165,000 miles, and they are required by federal law to decommission them. We contacted them, and through the generosity of Mid-Road Foundation, funding to obtain this van and funding to provide for maintenance and gasoline and costs of the van for a 4-year grant was proposed and granted through Mid-Road Foundation. So the van is wonderful, it works, and we're extremely indebted to people that helped us obtain it.
And
Excuse
it's
me, Mayor.
owned, yeah, I'll
There's
get you
people
a sec.
online that are trying to watch that can't get online. I'm getting texts from people that are trying to watch.
Having
Sorry to
trouble
interrupt.
online with the,
Okay.
okay. So Mint owns the van now?
Technically, it's under the name of All Care Foundation for Mint. We are still being created, so we don't have our nonprofit status. So the registration, for example, insurance is all carried by Mid-Road Foundation, and I'm the one that signed the papers, so my name is on there as well, but I don't think I have any personal liability for that, at least I hope not.
Okay. And then you said you work with 14 partner organizations? Okay. Did you have a different question too? Go ahead, Dwayne.
Thank you. I don't think we're here to dispute what you do. I just want to know, how do we make it fair for everybody and less impactful? What do you think your advice would be to the people that are on the other side that say you're impacting their home or something nearby the parks? What would you give to me to tell them?
I don't doubt that that's true.
Yeah.
I mean, who could deny that that's true? I mean, we know that. We don't have blinders on, but we're looking for what other alternatives do people have who share 3 things. Virtually everyone that we in Cassie, Connie, Bruce, Ruth, anybody that works for Mint sees. They're impoverished, so if there's a pot of money we can give them, that would help. That's not going to happen. They lack housing. They would love, I would say most, 90% want housing. There is none. And they lack what everyone here has, a social safety net. A family, a friend with a couch, a brother in Tennessee. They don't have anyone. So until we have answers for poverty, housing, and lack of social fabric, we're going to be here back again year after year after year.
Can I say something? Hold on real quick. I do think that there is opportunity for us. I mean, like, that concerns me to hear that crime goes up after Thursday. That's the first I've heard about that. I have a great relationship with the folks. You know, that's something that us and the other outreach workers, you know, we can bring that up to the folks that we're helping and saying, hey, this is what we're hearing. Here's the risk. Help us out. Additionally, I'm more than happy to get together with the people that live near the parks and talk about a way that we can support them better. You know, because I live a mile from all the parks and I'm a single mom. I'm right there with them, you know. That's half the reason I went out there, is to figure out what is actually going on. You know, do I need to move? You know, and so Mint is very open to collaborating on that effort, because that is a concern, a huge concern.
Cassie, do you track at all, like whether people are staying in the park where you're meeting them or whether they're coming there for that service?
Yep, so all of them that do go to the parks, the only place that people will move from one park to the other is Riverside, and it depends on their hunger need. You know, so if people are at Tussing or a Baker and they're really low on groceries, they'll go to Riverside because that's our first stop and they get the best groceries. But other than that, generally speaking, if they don't migrate to the parks to get the service, with the exception of those that are staying at Lawn Ridge, the West Home, and Gilbert, that some of them do come down to Riverside on Thursdays at 9:30 to receive services. So I don't see people moving in from different cities and stuff on Thursdays, staying the night and creating more crime. So I would like to get to the bottom of it. What I've noticed from a trend is the first 2 weeks of the month, higher crime, and that correlates with pay. Right, people get their food stamp cards and stuff, and so that's what I've noticed. I didn't notice an increase on Thursdays.
Joel?
So, appreciate what you do. Okay, it needs to be done. We can set that aside and keep doing that. The question is how do we coordinate so that everybody's needs are met? Not just one segment of our population. That would be as bad as excluding the homeless from the park and saying people with kids got the park. That wouldn't be what we want the future of Grants Pass to be like. So as we move forward, I think of On Track when they came before us as for grants. They had a navigation center proposal as part of their proposal that the city council didn't fund. Okay, I know All Care, and you know that too, has money to invest in positive outcomes, as does the other nonprofits. Have you reached out to other nonprofits to make this even better for everyone? Such as contacting On Track to see what they could do about a navigation center. That's just one concrete example that I know of, rather than just going out and saying this is what we're going to do and not talk to these other people.
We talk to them quite a bit, yeah. I mean, I'm constantly talking with people on Thursdays about what their plan is. You know, I think one thing that we need to be mindful of when we look at a navigation center is not everyone out there has substance use disorder and mental health disorders. And what the disparity that I'm seeing that's so huge right now is like we've talked about, that elderly population, you know, and so I think that whatever navigation and solution that we come up with needs to be all encompassing and not focusing on just addiction and mental health. While it is a huge problem, huge, I'm not undermining it. If you look ahead at the projections for 2030, it's the people over the age of 65 that are gonna skyrocket. And so like, I just wanna see the city of Grants Pass think very long-term in that, so that we get ahead of this eventually.
And there's no argument here.
Yeah.
Yeah, a navigation center meets some needs, Mr. King, but the issue is, as Cassie said, there's, you know, it doesn't matter if you have DHS office at the navigation center or in Riverside Park on Thursdays, they don't magically pull housing out of their apron and give it to people. You know, we don't have housing. So a navigation center, it doesn't have the answer for that. It doesn't, you know, they have a great model in Medford, which I follow closely because I've worked with them. So, you know, no one has the answer. No community has the answer. A navigation, we would love to see things more centralized too. It'd save gasoline if nothing else. It really would be best. But give us some options. And until then, we see ourselves as a very big Band-Aid to address a need that's not being met any other way. Would we like to have it consolidated in either an area of low-income housing or an urban campground or a navigation center? You betcha.
So what I hear you saying is you're treating symptoms, not the cure.
Oh, we're not fixing anything except, you know, like that fable of the little boy on the beach with all the starfish that got washed up, and he's throwing one back in at a time. The man asks him why he's doing that. You're not helping anything. And he goes, I helped this one. We are picking starfish off the beach. We would rather they not get washed up.
Valerie?
Yeah, I get it, and I worry about the handicap, but I also look and say, have we worked with the Josephine County Transit? I mean, is that an option to have a bus to get people to, you know, a location or whatever? I mean, I look at like Tussing Park, it's such a small park, you know, and you've got all those people going in there. I mean, could we somehow work with JCT or whatever? We talked about Ready Ride or something to actually have a system where we use a bus on a regular basis to have that work. I mean, I'm just looking for a solution.
We worked with them when the warming shelter got up, and they were great and gracious and offered rides from the parks to the warming shelter. The hard part is changing behavior of the unhoused and getting them to trust that it's going to be there consistently, right? And so I do think that that is a viable solution. And we haven't been going to Tussing as much because, you know, I heard I saw on Thursdays that people that live near there started parking their cars. So we heard the message loud and clear. So we started bringing groceries. You know, last Thursday was the first time we showed up there, and it was because there was a lot of elderly, vulnerable people there. So I actually recognize and appreciate the safety concern at Tussing, and we've instructed as many of our groups as possible to park at all sports park and take the bridge. So I recognize that. But I do think partnering with the transportation department would be maybe more of a long-term solution to look into.
Can you explain what's going on with parking? I haven't heard of this.
Usually I do rounds on Thursday morning to figure out where my friends are, right? Because they move every so often, and sometimes Tussing's full, sometimes it's not. We like to hit the parks that have the most people, so that we touch the most people, right? And so I've just noticed that sometimes on Thursday mornings there's just extra cars parked there, which is totally fine. I get it. It prevents us from coming. I mean, it was a successful solution, and it also I heard the message, but yeah, we just seen a lot of cars parked in Tussing, which has prevented us from being able to go there on Thursday. We went late last Thursday to be able to meet people, but like I said, we worked around it and just got them food privately.
So citizens are parking their cars at the park in order to block Mint from being able to provide services? Okay, good to know. Questions?
Just one other thing, working for All Care, I did approach them about Ready Ride for more frequent, you know, could you pick up a group of people in the park and bring them to the shelter when the 108 degrees and smoke was horrible? And they said no. So they said they just didn't have the resources to do that. The other thing is dogs. I know I brought this up last time. Dogs are important to people. Sometimes that's their only companion, their only thing of value. And unless they are a certified medical certificate service dog, Fido is not allowed on the bus, which means people will not. I mean, I know a lady right now that will prefer to die in the park in a tent than take housing without her dog. And there are many, many cases like that. So there are problems with transportation, but JCT would be wonderful because I didn't get the impression that Ready Ride through All Care was going to change their policy anytime soon.
Other questions right now? Okay.
I only want to make one other statement, and we have a lot of elderly people that can't walk out there. We have 2 people in the hospital right now. They would be more than willing to stay at the Gospel Rescue Mission, but they can't because of their disability, you know, and that's their only solution right now. So I'm just throwing that out there as a area that we have opportunity on.
And that couple, the man has a dementia and the woman has a brain injury. They will not be separated. I could not put them in the hospital last night unless we got permission to keep the wife with the husband. They are that dependent upon one another, and that also, I love the Gospel Rescue Mission too. That's one more barrier they just wouldn't have met. Yes?
Oh, we don't want to get sidetracked on one patient's thing, but so nursing homes are not an option?
Oh, they are. No, can I?
Oh, yes.
I mean, if a patient came to us in our primary care office, we
yeah.
would arrange that so they're taken care of.
100%. And I work with healthcare insurance companies on a regular basis, and Medicare is very challenging to work with. In order to get a patient admitted to a SNF, they need to see their PCP. We have a lack of access for that, right? But we're working to get them in so they'll see their primary care doctor. We need to then get the proper documentation, and most of the time they're going to require an inpatient admission for them to be able to transfer to a SNF. You can do it on the outpatient setting, but it's hard with a housed person.
Well, the hospital also does it when they discharge plan.
They do if they meet inpatient status.
Yeah,
So like
yeah.
this gentleman that we're talking about, he's on observation status.
So there are options there. You just say there's some paperwork involved and they need to
Yeah.
get it done. They don't need to stay on the street. They can go to a nursing home.
And that's what we're working on
Medicare
right
and
now.
Medicaid can pay for it.
Yep, and that's what we're working on right now, but
Okay.
without PCP, it will take a little bit of time. Sorry.
Hello.
Sorry I'm late. I'm Kelly Burnett. I'm the Chief Medical Officer at All Care, so I have a mother at home on hospice that I had to deal with.
We were just wrapping up questions here for the moment with Mint, but was there anything that you wanted to say before we?
Sure. A couple of things, and I heard there were a couple of questions regarding All Care's plans, but, certainly, in a perfect world, we would have housing for everybody, or we would have a low barrier shelter where people could be, where it would be easier to connect them to services in terms of long-term housing, healthcare, food, et cetera. Given that those things are not readily available right now, it has been helpful to have a team such as Mint that can go where people are congregated, so that we can try to help do that assessment and navigation. That All Care has tremendous difficulty for our folks that are unsheltered, even getting in contact with them, that we don't know where they are. We try to give people phones and then they lose them, and we're back at square one. So working with the Mint team has really given us a great opportunity to build those relationships, build trust, which is a huge part of building those relationships. And then, doing that navigation to try to have some solutions in terms of addressing their healthcare needs, working on finding housing, et cetera. So, given that we don't have these other alternatives right now, this has really been a game changer for us, that we've had some successes. It's one at a time. There's not any big issues. All Care is working, with the state and other agencies as much as we can to look at other housing opportunities. We are not allowed to directly, build housing, or, there's rules about how we can spend our money and what we can do. So that is a limiting factor, but we're trying to figure out how to have innovative ways to do that. We have had some projects recently that have, on a small scale, provided housing opportunities and freed up some other options for other people, but, it's slow going. Yeah.
First, I appreciate you being here. I know you're busy. And with Judy being a hospice nurse, she appreciates what you do as well.
Yeah.
The three questions I had, one, have you coordinated with any other nonprofits for a navigation center? Because it seems like other nonprofits are interested in it as well, they have money as well.
Yeah.
And On Track was the one I was thinking of, because they came forth before us with a proposal for a navigation center a year ago. And the council funded the recovery, but they didn't fund the navigation center.
Yeah, we have a chief innovation officer that's working on this right now in terms of really trying to increase those services that are available. And part of it is having some, different partners, having a location that I think is easily accessible to folks that need that. There's a couple of older buildings that are near Riverside Park right now that I think if they become available would be perfect for that, given that we have a lot of people that access the park right now.
So have you contacted the other nonprofits then?
Yeah.
Okay, okay. So All Care put in for a grant for a low barrier shelter. It's the second time, I think. They didn't get funded.
Right.
Why?
Well, I don't know the full details of that because, but I think it was not having enough runway to kind of develop the different relationships needed for that proposal. And also, I think there was another proposal on the table that got funded that had been involved for a while. So, certainly we're still working on that. Would still like to see that happen.
Okay. Okay. Well, thank you for what you do. I did have a third question, but I was listening to you and I forgot what it was.
Okay. All right.
Yeah, I just have a question, because I know that there's been a change, and it's, in terms of, in Oregon, in terms of us being able to use Medicaid now in a different way to help the homeless. Can you kind of explain that to me, how that is changing things?
As much as I understand it myself, that, it has been a priority, for the governor to support these services. There's a new benefit that will start coming into effect in 2024 called Health-Related Social Needs Benefit that is only for a particular population, but one of those populations are for folks that are homeless or at risk for being homeless. Because of the difficulties with addressing the housing need, that has gotten kind of bumped down the road a couple of times. So I think in November right now of 2024, it is to address people at risk of being homeless, which is a little bit easier lift in terms of rental support, things like that. For folks that are truly unsheltered, that will probably be in 2025. And again, it's because, a lot of areas around the state, such as Josephine County, just don't have, we don't have the bricks and mortar to house people. We can't magically, and, again, we can't build it. We can't, there's not enough funding, at least in All Care, and I'm not sure if there's enough funding for anybody right now to create what we need to create to do that.
And this is what I'm perceiving and from what you're saying, is you're saying that the money they're giving you isn't for the building of it. It's not for
Right.
capital expenses. It's for the, rent assistance to keep people who
Right.
are on that edge from slipping down the edge and keeping them where they are in a safe.
Right,
safety.
and yeah, it's a 6-month benefit, so up to 6 months of rental assistance, 6 months potentially of hotel or motel stays, which is limited inventory in terms of what's available, and that's very expensive, things of that nature.
Okay, thank you.
There was a comment earlier about the skilled nursing facilities as a resource. Currently for medical needs, it's a time-limited resource that, for Medicaid, it's 20 days. For Medicare, it's, I think, up to 100 days. Beyond that would require, being qualified for APD, adult and persons with disability coverage. But yeah, otherwise, the CCO and Medicare benefit is fairly limited.
I remember my question.
Yeah.
So All Care now has the capability to pay vouchers for lodging. So, and that provides some stabilization in the short term for people that need that emergency care.
Right.
And it's pretty low barrier. How many vouchers have you issued, do you know, in the last 6 months?
I don't know the number off the top of my head, and I'm a terrible person with numbers, but I know we have easily outstripped what we have paid for this year. We've, for like the last 3 or 4 years combined, that that there's such a need, and also there's more awareness of the.
So it's a significant program providing shelter through these vouchers.
Yeah, yeah.
And then it also is a partnership with the local motels that they get. So the cost of a motel room versus a low barrier shelter, have you ever compared those two if you were funded through a grant?
I haven't looked at that personally. I would assume that a low barrier shelter would be, but I don't know. Yeah.
It's not.
Yeah.
Okay.
I'm responsible for many things at All Care, but not specifically that one. Yeah.
Dwayne?
I just have a question for you, Mayor. I just want to know, are we going to the purpose of the workshop and how do we achieve the goals, looking at the objectives on this thing. And I'm not debating whether their services, but how do we get to the goal objective? Because we can,
Yeah.
seems like we ask a lot of questions and going down these rabbit holes of, and
You know,
I would
council-
like to keep this from a meeting not being 5 hours. I think we understand that there's services needed, but
I
how do we
agree.
come to a common ground of the objective today and not dispute what Mint or what other group is doing? I think we've all can agree that they're doing good things, bad things, whatever it is, but how do we keep to the objective of coming to a common ground that everybody's needs, that use of the park is taken care of and they're not violating other people's rights or whatever? I just want to see if we can get to that point.
Well, as with any conversation, I guess, that we have as a council, I mean, I can't read counselors' minds, and so it is up to them when they're asking questions to decide whether their question is pertinent to being able to move forward on a particular issue, or whether it's something that they could ask, outside of this forum. But yeah, I do want to move and ask PATH, because we have asked them to be with us today, to see if they have anything that they wanted to contribute, and then we need to move into a council discussion on what we want to do and whether we want to move forward on taking any further action, I guess. So it looks like we have Julie Thomas now with PATH. Did you have,
Yes.
want to give
morning.
us an update on what PATH sees their role in this as?
Yes, thank you very much. I actually didn't come prepared to do a presentation, but I have an opportunity to share who we are, so I'm going to do that. And a little bit of history. I'll start with being personal. I grew up here and raised my kids here, was a Grants Pass police officer for half of my 20-year law enforcement career, went overseas doing 18 years of law enforcement, international law enforcement, and came back and did security for 13 years here. So I've been in Riverside and other parks for most of my life. And what we're experiencing now is we've never seen anything like this. And so it can't be ignored. We know the importance of that. We know that there's a lot of communities suffering the same, but we know it's not everybody. So there are solutions. We don't know it all, and we're not be all. But PATH has come together as a grassroots advocacy group, an action group, to identify what resources that we have available to us, identify what needs we have, and then bridge that gap. Wherever that gap is, that's what we want to do. And I think we've made huge strides in that already. Just identifying what some of our local nonprofits are doing, and do we support those efforts? Are some of these organizations getting people housed? We have subcommittees, including a housing, location, and facility subcommittee. We have information and communications. We have outreach. We have operations. And all of us are working in different areas to really, again, bridge that gap. We support everything that Mint does. The struggle that we have in our current situation is that people can't live like that, and we have a really hard time supporting people staying in that situation. I'd love for Mint to work themselves out of a job. I'd love for us to have another conversation a year from now, because we made a huge impact. So what we're doing is we're not duplicating what others are doing. We're trying to fill that void. We do support that the city has to protect themselves from liability. We do understand that the community has a right to be safe and be protected. But I understand that the city wants to make sure that the people who are serving in the parks and the people who are being served are also safe and protected. And that's a responsibility that the city can't get away from. I worked city, county, state, federal government. That stuff's never going to go away. So I get that. So PATH supports something to gain some kind of control over that, but still be able to provide services to people who need them. In a perfect world, we would have a location where all of these 14 nonprofits, because outreach is very important, I think, because they're not going to go all the way up to all care to get service. But if there's a location where everybody could go and everybody could provide those services that are not in our parks, that are not in our neighborhoods, where people are complaining or not feeling safe or feeling vulnerable, that would be a perfect world scenario. And I think we can get there. We're not there today, though. So some of this stuff has to continue. So what we did as PATH is we got together a group of, we have a steering committee that's kind of guiding the direction that PATH is going, which can change on a dime. And we came to consensus about some recommendations that we made to the city to make the ordinance a bit more user-friendly for all involved. And that is, instead of, and I won't go through the whole detail, you have it, and Augustus has it as well, but simple things like, instead of having them just go once a month, what about once a week? They're doing that anyway. And if it's under controlled circumstances and people they have insurances and they know the rules and they have the permit and the city knows what's going on, that might be a great way to bridge the gap until we have a location or a place for people to go. We're focusing on sustainable solutions, and our number one goal is that every bit of our being is to get people out of this situation and back into a life of sustainable health and a good life, and to be able to contribute to society. And it's a long haul because we have mental health and we have addiction and we have disabled people. But we're really excited to support all the housing projects that are finally opening up here, which has been a really long time, and thank you all for helping to make some of those happen. We worked really hard with Mid-Rogue to help them furnish and fill their senior house up off of Hillcrest. We're really excited about that. It's my coffee cups that they're drinking out of. They're going to be working on a veterans housing project. We're super excited about that, and we're going to support that in every way we can. The Gospel Rescue Mission, because of a meeting that they came to with us, got very excited about a project that that's already been approved by the board, and they're moving forward on something like that, which could house many people. We found out about I can't remember the name, but the 60-unit apartment building that's opening up, and we got the word out to every single entity that we could find to make sure that they're helping. Excuse me. I knew this would happen. So that we knew that people knew about the project and that they were helping their clients to fill out those applications, whether it's UCAN, whether it's Maslow, other organizations, to make sure that those people who can qualify, and it's very low barrier. I don't know if that's the right word, but I even talked to the city and said, hey, if you guys do some kind of application processing thing to get as many people to apply, we're here for you. We've got a lot of volunteers that can help do that. And the city really appreciate doing that. So again, we're here as a resource. We're not a 501c3. We don't need money. We don't need to compete with any of our local nonprofits. We want to support those nonprofits that are doing great things in our community, and hopefully, like all of you, hold those that maybe are not benefiting those in our community, that we don't actively support that, but then maybe get them into an alignment. And again, our ultimate goal at the end of the day is to make sure that every single person possible is housed and able to contribute in this community. And it's a long haul, but we're not going to give up until we get there. Any questions? You're welcome.
Thank you, Julie. Any questions? Nope. Okay, thank you, Julie and Mint, both Path and Mint, for being here. Let's move into council discussion about this idea of regulating services in the parks. What goals or questions do you have? Anybody? Joel, then Val?
So it's very apparent to me we have mutual goals, and we need to get together and talk about them. And I don't think that's been done in a serious way. It's also apparent to me there's a lot of resources I don't know how many vouchers All Care is given out, and if they're the only ones, but I bet you it's in the hundreds, if not thousands, which is, that's a pretty good low barrier shelter right there, and it does cost All Care some money when they do that. I understand that, though it's probably cheaper. Somebody else might pay if he had it as a low barrier shelter. What I would like to see is, as we move forward in these mutual goals, and it has to be the neighborhood, it has to be the use of public land for everybody, not just for one needy group that needs some help, and it has to include the needs of those people, that we come together with a mutual solution. And we're not going to do that today. But I would, where I'm struggling with, does that need to be, you got your organization, we have the city organization, we have the parks organization, we have these other nonprofits. So how in what forum do we discuss that? The county has a committee on mental health and addiction, but that just deals with those two parts. And as it was pointed out, that's not the only solution. It's part of the solution, but it's not the only solution. So as we move forward, what group should we have to look at what the permit looks like? If there is a permit for time and place, what places are outside the park that nonprofits can provide, outside even of city resources, and maximization, sorry about that, to maximize resources like the voucher system that All Care is presently using, and going forward and making good sense of it. Lack of money is not the problem.
Well, do you have comments about the regulations that were proposed in the park back in July? Like, is this something we need to move forward on?
I think we do, but I think we need to do so in partnership for our mutual goals. I think our citizens deserve that.
Well, we did.
A couple things, because we're going to have to have
Council,
the conversation.
do you want to allow back and
sorry.
forth discussion, or?
It'll be quick, it won't be a discussion.
Well, hang on, because usually we don't, once we move
That's
on to
okay.
council discussion, but it's a little
okay.
different today. We don't have a set plan.
Yes.
Do you want back and forth?
Yes.
I'm getting a couple of head yeses. Okay, so to jump off of what Joel's talking about, a couple of things that we think might be a good idea and we should consider however you format that conversation. It's a multifaceted problem that requires multifaceted solutions. So we may all have to hit it from different directions at the same time, right? Two things that I thought might be helpful is that if we were to move the services to the West Riverside Park, it's less exposure in the neighborhood, and I know maybe a little bit of fencing or something for the 6th Street traffic, but that might keep people where they are temporarily and getting the services that they need with less impact. And the other thing is, we don't have to look at public spaces all the time. Private property is also a possibility, whether it's in the city or a county. And then other than it becoming maybe a nuisance, there's all kinds of services that could be provided without the city having to have so much oversight. That's it. Thank you for the opportunity.
Okay, so I do want us to, talk about, the regulations that were proposed, and obviously we took a pass on it back on July 19th, but this is our opportunity to bring that up again. Are there goals that the council has for something that you want to, data you want to collect, something you want to regulate, allow permits, or are we just going to let things continue the way they have been? DJ?
Yeah, I was up for.
Valerie.
Okay, all right. Yeah, I think that's what we need to focus in on, and I believe the liability is important to us to indemnify the city. I think that there does need to be some sort of a permit, because if we are going to know what's going on, we need to know what's going on, time, place, manner. I mean, the communication back and forth. I think that's key, is that we have that, and data collection, the number of people that you're serving and the number of people that you're, helping to get into housing. Because it seems to me in talking that they do a lot of together work. I mean, they obviously are working together. So it's not so much about, I don't want to step in the middle of it, to tell you the truth. They're the professionals, they're the ones that are out there. But I do believe on our side, we need to protect the city, we need to know the time, place, manner, meaning what it is exactly that they're doing, and expect a certain collection of data so that we have that information. So that, I think, is what we're kind of addressing at this point.
DJ?
Oh, sure. I agree, Val. You said it well. The 3 bullets on the end of the background. The city's entitled to know what's happening in the parks. The city's entitled to indemnification, and there's a lack of information. I think I'm kind of seeing that as being the goal. They have the right to provide these services. Nobody's getting in the way of that. But the city, as Augusta said, we have the right to regulate the public lands. I heard loud and clear that these organizations are going to operate regardless. But aside from that, we need to structure an ordinance that that's acceptable by city standards. Every other organized use of park needs a permit, so we understand what's happening. We can gather information and evidence on that, and I would treat it functionally identical. If it's organized use in the parks, you get a permit, and there's rules to it. In agreeing with what Valerie said, the only item of contention that I understand right now is the ordinance recommended monthly use of the park, and they want to see weekly use of the park. We can talk about that, but going after an ordinance that clearly structures time, place, and manner of this organized use in the park is what we should pursue.
Brian?
So I just wanted to get clarification from Augustus regarding permitting in the parks, because earlier you said, you know, if it's over 100, you need a permit. If it's under 100, you probably don't. So I would assume that most of these things are under 100 people. So how does that work?
There's actually really not a way for us to know. There is not enough information for us to know that.
To know what?
To know how many people are being serviced at each park at any
Well,
given
they
Thursday.
know. Can we ask them?
They might
Are they
know,
having
but
gatherings over 100 people?
yet, respectfully, Counselor, they don't make policy here, and we aren't being provided with the data that we would need beforehand. So that's really what I think what you're really wanting to get after is the data. How many people are they servicing? How many people are being helped? That's not something that we have access to at this point in time, so there's no way for us to know.
I'm aware that they are not policymakers. However, they are the ones doing the events. They are the ones on site. They are the ones that would be providing us the information that give us the information we need to make policy, and they're in the room right now. And so I'm wondering if I can ask them if they're having gatherings that are over 100 people, because that's seems to be a relevant piece of this discussion.
Yes, it looks like Dr. Murray, if you could step back up to the mic, or Cassie, and let us know how many people, if you have that information.
The mic's not on.
Is the
I'm passionate enough, I was talking loudly. Okay, so every Thursday we feed between 80 and 120 people. And by feed, I mean we give them groceries, because I have to report out to the food bank on that. So that's a number I know each week because I turn it in. That is among 3 or 4 parks. Never is there more than 100 people receiving groceries at Riverside Park. And I'm going to bet 98 to 99% of the people that come to our services receive groceries. So I've never seen more than 100 in one location, but definitely more than 100 among the 4 locations.
Thank you.
I totally agree. As the barista, I provide over 120 cups of coffee a week, spread among 4 parks.
All right, Joel, or Brian, are you not done? Go ahead.
Well, just to,
Just jump in with one last thing. We are totally nonprofit, so I don't know what moving permitting from monthly to weekly is. I'd prefer it be once a year for $1. We have no income. Anytime, so if it's a weekly $25, that's $100 worth of medical supplies I can't buy. So please keep cost in mind. Don't make it punitive. We are not fighting the regulation issue, but please realize we have no income.
so to get,
I think the proposal was that they would only provide service once a month. Is that?
So the original proposal was once a month until I was receiving feedback from the groups when I asked for it. And then it became clear that they're there once a week. There's no reason why that shouldn't be happening once a week. And also the original proposal called for a 3-month permit with $25 administrative, it actually didn't have an administrative fee attached to it, but it was going to be something nominal, like $25 for a 3-month permit, which would have equated to $100 a year. There was also confusion about the deposit, which was going to be $250, which would roll over from event to event unless it was used to clean up the park, and then they would have to replenish that $250 before doing their next event, and that deposit was fully refundable. So that's at least my recollection of the discussion council had, and the members of the public came and voiced their opinion during public comment. That was my recollection.
Okay, yeah, so there are two time elements. One is how often people use the park, one is how often they permit, and then there are two types of fees, both the permit fee and the deposit.
That's largely
So-
correct, because when I was crafting the ordinance, I was having difficulty determining how much time should pass before a permit should be renewed. I thought that a permit renewal every month would be too burdensome. I thought that 6 months was possibly a little bit too long. That's why I opted for 3.
Okay, Brian, continue, and then Joel.
Okay, thank you. So other groups of this size are not being made to permit, and from what Augustus said earlier, groups of less than 100, it might be tricky constitutionally or something, like, I'm not sure exactly what, but I'm not sure how we're justifying a permit process for this, given the size of the gathering. So I don't even know why we're talking about the details before we get to the point where we are justified in doing a permitting process.
Joel.
So what I hear are several different objectives from several different members of the community. I think it's probably to the advantage of the nonprofit that they are permitted. They are legitimate, and they are embraced by the city in what they do. I don't see that as a negative thing. I see that as a positive thing moving forward that the community needs. Regardless of whether it's 101 or 99. And the other thing is, I think that as we formulate this, you need to be at the table. And I would embrace that, and you represent very well the objectives of those people that need the help. The city will represent their interests, but then the interests I don't see represented in moving forward is somebody like Jenny being on the committee to formulate this that represents some of the neighbors, and that all interests then are represented as we move forward, and we do a wonderful thing for this community that not only legitimizes you as a nonprofit, but is effective. And not only does that, but protects the neighborhood. And not only that, but protects the city. If we do less than that, I think we're in our pea brain, and we do less than what we could.
Augustus?
So if there's apprehension about the permitting aspect, I guess the central question that I have for council is, what are you looking for? Are we looking for more of regulation, or are you looking for more of oversight? At least the way this conversation is trending, I'm willing to bet that council is looking for more of an oversight role. Now, if you put this in a situation where you're now at one park, you're definitely going to have more than 100 people. They've said themselves it's 80 to 120 between all 4 parks. Now, is council more interested in metrics? Is council more interested in data? Because it's quite clear what Mint is doing in the parks. They're not making, it's not anything that's groundbreaking, and it's not anything that's a secret. They're giving out food, and they're rendering medical services. They're rendering case management, and they're out there helping people. So your permitting structure can take place in any one way. Now, while the Bullhead, Arizona example was the template, I didn't just copy paste the template and call it good. I had to do a lot of other case research. And so what I structured was an amalgamation of provisions that, based on case law, I believed were constitutional. You can do less than that. You can do an ordinance that expressly permits this behavior and requires certain metrics be submitted to the city and call that good. But it's really the central question is, what is council trying to achieve? Are you trying to achieve regulation, or are you trying to achieve oversight while maintaining the status quo in some form or another?
Ed, I'm interested in knowing how many counselors are interested in having some sort of permit as opposed to doing nothing. So please raise your hand if you want to have some sort of permit process, because then we'll know if we even need to consider the, continue the conversation here. So 2, 3, 4, 5 with Rick. Were you a latecomer there? Oh, you have a question? Go ahead.
So the permit process could just be a matter of tracking information.
Yeah, I mean, as a starting point, we just need to know, do we even need to have this conversation? If people don't have concerns, or they want to just leave things as they are, then we can just stop. But if you want to do some sort of permit process, and it sounds like maybe 5 of you or 4 with a question here are interested in moving forward, then we need to determine what your goal is and what it is you want to have this process achieve. So where did that come from, Joel?
So if the desired future condition, what do we want the future for Grants Pass to look like? We want effective nonprofits. We want people in the park taken care of. We want the neighborhood safe. We want people to use the public parks. That's our objective. It's very clear to me. The permitting process, and what was the other thing that you talked about, Augustus? The monitoring or?
Insurance indemnification oversight.
Oversight. Those are just tools to achieve that objective, and you probably need both. But we all need to be at the table when those are done. And it's very clear to me, and it makes sense. And don't let your fears drive our behavior, because you'll end up in a bad place where we are right now. There's hope.
Okay, counselors, it sounds like there's some interest in moving forward, so we need to be specific. What goal are you trying to achieve? What do you want to know out of this permit process? Dwight?
I think we need to be well, first, I think all of us need to be respectful of others. Secondly, I think the city has to avoid its liability of things happening in the park. So the oversight should be the liability of the city. If something's happened in the parks, we're responsible for it if we know it's happening. So I don't think it's about not allowing them to use the park, because they have a right to use the park. It's the liability purpose of the city. So first of all, it needs to be the liability. Are we liable for what they do in the park? If we allow them to do something and then we get sued because someone else gets hurt, or I want to know those issues, the liability part of it. Are we infringing other people's rights that want to use the park? I think we need to worry about that too, because the parks are not for 600 people that are supposed to be homeless. They're for the whole city of 40,000 people. So we need to make sure that we're allowing everybody to use the park evenly, and we're not disrupting the neighborhood. So I think those are the things we should be really focusing on.
Okay, so Augustus, that's a legal question. Is there liability if we allow this use either through a permit or tacit approval?
So if something happens to the park, it's not going to be covered under recreational immunity. Now, the threshold question you're asking is who's responsible if somebody gets hurt? Well, the entity with deep pockets is always going to get sued. And in that case, who's the entity with the deep pockets?
So what is the recommendation to protect the city from a legal liability?
So you can do it one of a couple ways. You could do it via ordinance, or you could do it via contract.
And elaborate, I guess.
So in the first iteration of the ordinance, a requirement for getting the shall issue permit was to provide ample insurance and indemnification from the city, essentially saying that we're going to provide the requisite insurance and we're going to indemnify the city for any acts or omissions for what happens in the park. And the second way you could do it is by contract. You contract with an entity and then you provide an indemnification clause through that contract. Those are the 2 more effective ways to do it.
Joel and then Val.
So, Mayor, you've taken a straw poll. We got 1, 2, 3, 4, 5 people that were in favor of going forward. I hear you asking questions but we need to go forward.
Are we not?
We need to move past it and give the assignment with the objectives that we've listed from those, at least those 3 interest groups, and we need to have those people at the table when it's being done, and bring it back to council for approval or modification.
Yeah, I think council at this point needs to state what their goals are. That's the question, and Dwayne has just stated two of his.
I'll repeat the goals then. The goals are to serve people's needs of the homeless.
I think we're just talking.
The second goal is to manage the public lands, especially the parks, for all citizens, not just the homeless. And so, and the third goal is to protect and enhance the neighborhoods so they don't have the existing condition of what we're in now. But there's those 3 goals that we need to move forward. And when we achieve those, it will be very nice.
Okay, we're talking specifically about a permit process for services in Riverside Park for the homeless, and we need to get to a point where the council is expressing specifically what your goal is for the permit so that staff can draft up an appropriate regulation.
So to do the tactical steps may or may not be appropriate at this point in time. We got the strategic goal in mind.
This is where we're at. I'm facilitating the meeting.
And we need their input for the tactical steps. And so, for example, is it at the west side of All Sports Park, or excuse me, of Riverside Park? Or the, no, that doesn't meet their needs. So we need to get a group together to look at that, to put those tactical steps down to achieve those strategic objectives. It's very clear to me. And for us right now to say, I want this particular thing or this particular thing without those groups' involvement would be a mistake.
Okay, we have heard from you. Thank you, Joel. Valerie.
Well, I think that right now, though, Joel, what we're trying to do is figure out the city's role, because that's what we're giving the instruction or whatever talking is, the city. And I agree with you that it will be, that we'll all agree and come up with something that we can both live with. I'm fascinated by the difference between the contract versus the permit, because when I said a permitting process, I didn't mean money-wise. I just want to know where they are and when. I just want to know, okay, they're going to be there Thursdays, so we can expect that. I think that's something, I don't think that necessarily deserves a permit cost, but then I also have to remember that there might be other nonprofits that want to work in the park too. So we kind of have to look at it globally, not just short term, where we're working right now with Mint, but there are other nonprofits that are going to want to do the same thing. So if that's the case, we need to look at it from that perspective. Yes or no? Go ahead, Augustus.
So when you're talking about contracting, we're talking about the specific issue of indemnification, right?
Okay.
So contract with one entity, your natural consequence is that whoever else wants to do the similar type of work is also going to have to contract with us. Okay. Now, that would be a contract between the city and the provider. Okay. It's an option.
Okay.
I probably would tend more towards a least restrictive ordinance. Now, okay. What I'm hearing also is that the ordinance needs to be written in conjunction with Mint. That is not a problem.
Okay.
If council wants to give direction to draft an ordinance, a permitting process that Mint can live with, that the city can live with, that achieves your goals of indemnification, that achieves your goals of oversight, that is least burdensome to their group and constitutionally passes muster, I can do that.
Okay.
I don't think that there's an issue with that.
Okay.
But I need to know if we want to do this permitting process. I'm hearing we want to do it in conjunction with Mint. I'm prepared to do that. I don't think that that's an issue. And, having spoken with Dr. Murray and Ms. Leach, I don't foresee any issues in doing something like that.
Okay. I also like the data collection, which they said they were happy to, just for our own long-term statistical information about how many people it is helping, how many people they serve each week, and also, when they have those success stories and they have people in either some sort of service that they've located for them or housing. I would like to have that as well.
And I think that that's something, working together, we can hash that out for sure.
So specifically, you want how many they serve weekly and success stories in terms of moving into a more permanent housing situation?
Yes, more permanent or.
Or at least out of the parks.
At least out of the parks, yeah.
Which could be mental health help or addiction services.
Okay, any other statistics that you would be interested in? Okay, hang on, Joel. Are any of you wanting to add in things that you're looking for? Rick?
I would want to keep that informational piece of paper very simple in that it could have parameters in it rather than specifics, because maybe they serve 20 people with food issues or something like that. But to not have them be bogged down in paperwork individually with specifics, but just ranges, you know, was it 0 to 50 or 0 to 100 type deal. So again, I don't want to have us be creating more paperwork that makes their job unattainable. Thank you.
Okay, DJ, is there anything specific you're wanting out of the permit process?
No, I think it was all covered when I spoke before. Thanks.
Okay, Joel?
I'm good.
Okay, so what I have is that we have a concern about liability, and so we're looking for some sort of insurance and or indemnification from services being provided, and that we want to know when and where they're providing these services. I haven't heard anybody suggest restrictions, so it sounds like at this point we're open to the 3 parks that they're providing services at, and that we want some basic numbers on how many they're serving, if they're able to kind of track, you know, food versus medical versus some sort of other thing, and even kind of a general sort of way, you know, 10 to 20 people, that sort of thing. And that we want to know about when some success numbers of whether people are moving into transitional or permanent housing. Does that cover it? Okay. And Mint, are like any red flags raising for you as far as something that might be hard or a question you have before we?
I would like to.
You got to use the mic, please, so that people online can hear.
Speaking for the practitioners, we do not feel that West Riverside is adequate at all. We do not agree with that statement, and we'd like to continue. If we have restricted where we are now, we're in that little parking lot between the apartment building and the Rogue River, between the 5th and 6th Street bridges. That's it for an hour a week. There's adequate parking. It's much safer than being directly on 6th Street. And so we would really like to advocate that those of us that are providing the services determine where it's the safest to do so and where we can do the most good.
Yeah, I think at this point, I didn't hear any concerns from council about location or times. It would just be a matter of tracking.
Yeah, and we are accomplishing that. Those of you that have been down there to see us see that no one's walking around with a clipboard or a counter. I can tell you how many medical, because I'm in charge of the medical services, and we're serving medically between 8 and 16 people every week, at least half of which would be found waiting in the emergency room if it wasn't for our services. So I can give you the medical, you know, how many people, it's people milling in, moving out. I want 2 cups of coffee, I want none. You know, there's no easy way. We will try, and Cassie and the nurse corps and me and the doctor corps, we're trying to get the numbers for you. It's a fluid situation, but I will say we're getting more people into stable housing and out of the parks and into rehab than any other organization in town.
I think it sounds like, yeah, if you have somebody double up on coffee or whatever, it's just going to give council a general idea of whether it's 15 people or 50 that you served on a particular day.
I just want to state that you guys changed the ordinances in June. We closed down Riverside, and I've seen a tremendous change since. So what problem are we trying to solve besides you want to be more involved? So I want you to think about that when you come up with the ordinance, because I have seen a change. It is working. It hasn't been that long, and we're not giving it enough time. So again, what problem are we trying to solve? Don't mind being permitted. One thing that didn't come up that we do want to address is insurance. Right, the insurance was pretty hefty in that ordinance. And then lastly, I honestly think that if we're aware of our citizens, now that I know what's going on with Dave, I'm gonna talk with Dave.
Yeah.
You know, and I really do believe that Mint is committed to working with the people near the park to make it successful for everyone, and we don't need ordinance and permits for that.
Augustus?
I'd like to reiterate that we are coming up with the ordinance. This is not a unilateral thing. We are going to put this together. So I just want to point that out. Indemnification and/or insurance, we can figure that out. But yeah, largely, I think that council's made it clear that it's less regulatory and more oversight. More knowing what's going on rather than seeking to control every little aspect. But we are going to work together on this ordinance.
I would agree with that. It sounds like keeping some information so that we know what's going on seems to be the primary goal, as well as making sure that the city has some protection if there were to be an issue.
Sarah, I had one last comment.
Go ahead, Joel.
I don't want to interrupt you. Do you want to finish first?
Oh, you already did interrupt me, so go ahead.
Okay, I'll be quiet if you want me to.
Go ahead.
One thing that we missed there in our summary was the neighbors, the neighborhood, and how to make it, and I know you folks are concerned about that. That's important to your success as well as to the neighbors. And so we need to, if there's some solutions there, and there's some obvious solutions, maybe on location that doesn't even involve a park. And so maybe this is the first step in looking at that with the nonprofits and what we want to do. And the non-voucher program with All Care, or the voucher program with All Care is we need to recognize your contribution with that as well.
All right, I think the other thing that we touched on kind of came up when Mint was speaking early on, is a continued desire to move people out of the parks. So even though, we're talking about here how to serve them in the parks and how to keep an eye on what's happening in the parks, to me, the repeated message is that it would be better if this wasn't happening in our parks, and that we need to keep working on ways to provide locations for people to be that are not in the parks. And I've been talking about this for 2.5 years, but let's get them out, so all of this other stuff as far as how to manage people in the parks is not, it's short-term compared to the big goal of getting people out of our parks. And I think we can probably move on to our other topic today, which is climate-friendly and equitable communities. Thank you, Mint and Path, for both being here today.
Thank you.
And looks like Mark is going to lead us on the climate-friendly.
Excuse me. Good afternoon, Mayor, members of the City Council. Thanks for hanging in there with me. Just before I start, I did create, our staff did create a little cheat sheet for you all in terms of explaining the 3 options in front of us as far as Park and Reform B. And also, there's also a map in terms of showing our existing transit corridor and what that transit corridor may look like in the future. I'm also looking to some folks from the DLCD that might be joining us shortly on Teams. That might be Evan Mandel. You might remember Evan. He presented to us back in February, and his counterpart there with the DLC, Ryan Marquardt. So with that being said, let me just start this slideshow. So we're bringing back climate-friendly and equitable community rules, also known as CFEC. The first phase of these rules were parking reform, and in the presentation, we'll do a summary of those reforms and what's in front of you and choices that need to be made today. Just as a summary, CFEC rules were initiated by the governor at the time, Governor Brown, I believe, in her Executive Order 20-04. Those rules were codified back last summer, and that put forth the CFEC rules in front of us today. We'll speak to an overview of the 3 options under Reform B. We'll also speak to things that we've learned in terms of staff and our ongoing discussions with DLCD, and also just monitoring what's happening around the state, in particular our ongoing discussions with our neighbors, the cities of Medford and the cities of Sherwood. And all the cities are in the position of having to adopt these options in front of you today. And we do have recommendation today as well. As far as the timeline, Reform A had begun January 1st of this year, and we accepted those rules administratively. In February, you recall, was our first introduction to CFEC overall in terms of what the CFEC rules meant in terms of parking reform reforms this year. And next year, we'll bring forward the climate-friendly areas to you all. In May, we reviewed the 3 options, and at that time, Council asked staff to go ahead and ask for the feedback from various commissions. And we got a chance to discuss these rules or reforms to the Planning Commission, to the Housing Advisory Committee, as well as the Community Economic folks. And we bring these options to you this month, and we do have a deadline to choose an option. The 3 options, one of the 3 options, our deadline to adopt that is in the end of the year. So just a quick summary, Phase 1, the Reform A took effect this January, and then essentially eliminated parking requirements within a half-mile of bus stops. In our case, bus route 10 and 35 were mapped, and in green is what we call our transit corridor, and you can refer to the 3rd page there of your little handout in terms of depicting that transit corridor. It also reduced parking requirements to 1 residential space for residential and multifamily units, and then also eliminated parking requirements for what we call community beneficial uses, and that included childcare facilities that serve the development disabled, as well as affordable housing. In March, this part of these rules started to address the state's movement towards increasing the electronic vehicle charging infrastructure for the entire state. So today, the building code requires 20% of new commercial parking spaces to be dedicated to EV charging. And then what that means is basically the conduit be installed. And for under CFEC, that increases up to 40% of new multifamily that needs to provide the installation of conduit for the total parking spaces that are planned for the community. We did a quick GIS study in terms of what that transit corridor is, and as you can imagine, most of the city, 3/4 of the city is within the transit corridor, and that goes back in January, and it is indefinite. This transit corridor will remain, as these rules will remain. So properties located within this transit corridor are no longer required parking. And we've explained this as a planning staff to various developments throughout the year. They're often surprised about these CFEC rules, but they haven't taken advantage of them necessarily. And outside the green area is about 23% that remains outside the transit corridor. So those areas are in fact are required parking for either commercial or residential. So these are the 3 options that we discussed back in May. Option 1 is to repeal all parking mandates citywide. And so the map behind me has these yellow areas behind me. So basically, those areas are outside the transit corridor, and if you choose option 1, those areas would expand throughout the city limits. And those are about the 5 areas where right now the parking requirements are required. Option 2 would pick 2 of 5 new policies, and then we also have to choose and then additional requirements in terms of unbundling or price parking or parking for on-street parking. And we'll review what that means as well. And option 3 are no parking requirements for 13 specific land uses. And that includes bars and restaurants. And again, the cheat sheet explains all 13 of them. And there as well, we would have to also choose a new program, either unbundling or charging for on-street parking. So those are the 3 options. I'll run through them right now. Option 1 is no required parking citywide. So basically our transit corridor or the area in green expands throughout the city. In terms of implementation, we just simply need to adopt this, this amendment to our development code. And no other new programs or rules apply moving forward. The impacts of this potential of choosing option 1 are obvious. There's potential of impacts on existing on-street parking if and when this option is chosen. Option 2 are 5 policies. These are new policies that we would have to create. We have a choice between 2 of the 5 in front of us today, and I'll just start with the first one. The first and second one are called unbundling, and we kind of talked about this in May. Staff has a better understanding of what this would mean, but essentially it would either unbundle multifamily or unbundle commercial. And basically what that means, for example, if there's an apartment complex or a multifamily development that charges $1,100 for rent for a 1-bedroom apartment, this requirement would require the parking and the rent to be unbundled. So if we determine that the fair market value of a parking space is $100 and that tenant chooses not to use that parking space, then by unbundling it, that tenant would have the option of only paying $1,000 because they're no longer needing that one parking space. And so that's the term of unbundling. And I'm sure your mind's kind of going where mine goes in terms of what does that mean and how is that effective and how are we going to monitor that. So the same thing goes with commercial. Similarly, there's commercial properties, commercial parking lots, and if a tenant chooses not to use their on-site parking, there might be an opportunity for them to unbundle that commercial parking lot. The third policy, new policy, is taxing commercial parking lot revenue. Talking to finance just briefly over the course of last week, and understanding what that means. There are both informal, what we believe commercial parking lots, and basically those are lots either privately or publicly owned that charge for a monthly fee. And so those revenues in terms of tax would be taxing those revenues and set aside 10% of that towards CFEC goals and policies moving forward. And we can talk more if you wish. We did get a chance to speak to other communities that, or at least one other community that's contemplating that policy. The fourth policy is requiring businesses 50 or more to have a non-vehicle commute reward program. So monetarily for their employees to offer perhaps a $50 voucher to take transit each month. This would be a mandate on those type of businesses. And then last policy is a minimum parking set for multifamily to a half a space per unit. You can see of these policies, we would require under these CFEC rules amongst the 1, 2, or 3 to choose one of between 1, 2, and 3. So we are mandated to choose. Our first policy would need to come from 1, 2, or 3, and then the second policy would need either be 4 or 5. Obviously, the implementation is, this would be a new program for the city, as well as looking at either creating a tax or unbundling residential commercial would be new as well. The impacts of this potentially are to businesses, to property owners, to landlords, to tenants, if these policies are implemented. Option 3, what we call our label, and again in your cheat sheet, there are 13 specific land uses that require no parking mandates. In option 3, we would be allowed to maintain parking minimums, especially for industrial uses, for commercial buildings of more than 3,000 square feet or have 10 or more employees. We would maintain a parking minimum for market rate 2-bedroom or larger, and we would maintain a parking minimum for single-family homes. Just to reiterate, the parking requirements would only be affected by those areas outside our transit corridor. Our transit corridor exists regardless of 2 or 3, and obviously in option 1, the transit corridor would expand to the city limits. Again, impacts of this would be businesses, property owners, landlords, tenants, and developers. Additional requirements under CFACT for these rules, there are a host of basically provisions that reduce required parking, and those are listed in the cheat sheet. For option 2, unbundling commercial is a choice for option 2. For option 3, charging on-street parking is a choice for option 3. And essentially what that would mean would be that the city would need to create a residential parking district or perhaps a public benefit district, for example, in the central business district, install meters and begin to charge for parking. And you can imagine what would be needed for that in terms of code updates, consultants work, and obviously the infrastructure if we were to choose to start charging for parking. Option 2 and 3 remain options under unbundling multifamily, and again, that is the example I gave in terms of if a tenant was paying $1,100 for the rent, and when it is determined that the fair market value of that space is $100, they would have the option of not to pay that $100 fee for parking. What we learned so far is having met with the Planning Commission, the Housing and Advisory Committee, the Community Economic Committees, they're all in favor of option 1. A little closer in terms of vote from the Planning Commission and Housing and Advisory. However, in terms of the economic development folks, they certainly leaned on option 1. They really saw it as an opportunity for business owners and residential developers to pay for less parking and to expand their business or perhaps offer more units. What we've also learned, most of the cities, of the 8 metropolitan areas in the state, most are leaning or have chosen option 1. And most recently, that includes our neighbor, Central Point. So again, the Parking Reform A measure in terms of the transit corridor has existed in January. Staffers only received 1 application that did not provide parking. It was for a small business located already within the transit corridor. It was an expansion of their existing facility to a modest 400 square feet. And they cited in their application that for them not to build on-site parking allowed them to have enough capital to expand their business. And so that was purposeful in their request for a permit. What we also know is right behind me, the JCT Transit Hub is going to be completed. And what we also know is that each year we're going to need to report our transit corridor to the state. And it is likely that our transit corridor will expand, particularly in the Fruitdale Avenue area, where I think is represented by Route 20. If and when that happens, our transit corridor, right now, the properties kind of circled in yellow. Right now, our transit properties outside is about 23% of properties are outside the corridor. That will shrink once our transit corridor expands. That will shrink down to 9%, where we're able to hold on to our parking requirements. And those are areas in yellow that we've have circled. Other considerations for option 2 and 3, again, these would be creating new programs, either unbundling or charging on-street parking. That would take a considerable amount of staff time to establish these new programs. And talking to the city of Sherwood, they've invested in terms of just 1 senior planner, and that takes up most of our time to just choose 1 option. So it's a heavy lift. We'd likely need to hire a consultant, and there will be a capital request for capital in order to create a new program or a new policy like a tax, unbundling, or a new program as far as charging for on-street parking. And it certainly would be open the door to the need of hiring new staff. Moving forward, there is no state funding for Parking Reform B or parking reforms in general or anything in terms of its next phase of implementation. We had the fortunate to have state funding for our CFA study and for outreach, but in the future, there's no future funding opportunities for us to apply for to implement these measures. And then lastly, in the OAR for CFAC rules, it does allow for flexibility. So if we choose an option this year, down the road, we find the need to pivot and change our options, we can do so. Obviously, we would need to go through the same amount of work in terms of pivoting, but the options, the OAR does allow us to change and to pivot to another option moving forward. So the call to action, obviously we have until December 31st to adopt an option of the 3 options. And in terms of the 3 options, it is staff's recommendation to move forward with option 1. There are no cost implications. This would be both administratively and also a development code update. But however, there would be new programs being requested to create or to fund at this time. The other alternatives be option 2, to choose 2 of the 5 new policies, but we would need to request at some point in time city funds to be allocated to hire a consultant or to help us implement 2 of the 5 new policies. Or option 3, the 13 specific land use exempt from parking, and the choice there would be either unbundling or charging for on-street parking. Either one would also require us to request for city funds and to look at hiring a consultant. Those are the 3 options. They're not great in terms of what's in front of us, but if there are other, that concludes my report. I have either Evan or Ryan from DLCD to kind of go through the technical definitions, but that's it in a nutshell. So that concludes our report. Happy to answer any questions.
Thank you, Mark. Council, do you have any questions? Rick?
Thank you for the presentation. As most people are aware, I've been involved with land use planning for over 45 years. And one thing I see, if you create more barriers, it creates conflict and not harmony in the community. So it really concerns me, over the years I've seen, the more adequate parking you have, the better the business will survive, the neighbors get along better in the neighborhood and single-family dwelling and so forth. So if we're looking at eliminating or reducing the amount of parking, is there also an avenue available where if we don't like any of these options, we can do something different?
In terms of the 3 options in front of us now, is there something for us? Is there an opportunity to do something different? Is that
Yes.
Either Ryan or Evan? My understanding is the answer is no.
Thank you.
Yeah.
Yes, this is Evan Mandel. Can you hear me?
Yes, we can hear you, Evan.
Yeah, there isn't a 4th option or unlimited number. These are the 3 options in front of you, as Mark pointed out.
I will just simply add is, although the city isn't requiring parking, we still have our parking standards. I think it is really just putting it on the applicant or the residential level or commercial business to dictate the parking they need. So if they do provide parking, they have to meet our standards. But what we've seen since January is only 1 business. We had close to over 20 pre-applications. Most of them do qualify for the no parking mandate because they sit within our transit corridor, and they are happy to hear that, but they still come back with parking, and that's what they've done so far. And we anticipate in the future that will occur.
Thank you.
Valerie?
Yeah, I guess I was going to bring up a couple of things. Number one, this is obviously market-driven because I can't imagine a business saying, oh, we don't need parking because they're not going to get any customers. So you've got that going for you. And the same with selling a house. If you don't have any parking, I don't think you're going to be able to sell the house unless you know for whatever reason. So I think that's only makes sense that the majority of people are doing this because the other options would be very expensive. I'm just kind of curious. So obviously, option 1 makes the most sense. It just puts it on the market to drive it. And then my question is, how much time staff-wise has gone into, just your part for this part of it? Because there has been, I'm sure, time spent on your part as well as other people in the planning to make this and pull this all together, correct?
Yeah, it ranges. I've monitored this since the beginning, and this was one of the tasks when I first started to monitor to catch us up to the CFAC rules. And I would say at least anywhere from 30 to 50% of my time just learning about what other communities are doing and getting feedback from DLCD, and also ongoing discussions with our counterparts in Medford, because they're also in the same boat. They're leaning towards one of these options. So it is considerable, and I'm just gathering information. The next phase, if option 2 or 3 are chosen, that will take my work into dedicating myself to choosing these options. But I would need the support of council in terms of a budget, because we would need to fund it somehow, some way.
And I just have one other question. Whatever happened to the lawsuit? I thought there was a lawsuit that was kind of like coming forth from Springfield, from numerous cities around the state that were questioning the climate-friendly mandates coming down.
Yes, there's a challenge to the validity of the rules. Oral argument was in June. We have not heard back from the Court of Appeals as of yet.
Okay, thank you.
Any other questions? No? Dwayne? Yep.
I think this is pretty easy. Option 1, I've been a part of these conversations already at the Housing Advisory. Let the market dictate what should be done. I'm sure the business can know if it needs handicap parking or whatever kind of parking. I think people are smart enough to figure that out. So I don't think there's any other choice than option 1, and let's move forward.
Does anybody want to make an argument for anything other than option 1? All right, sounds like we are agreed upon option 1. Easy does it, huh? Anybody have comments? I don't want to cut you off if you got something burning to say, but I think we're probably done with that one. All right, next up, agenda review. Thank you, Mark. Quickest discussion ever. That means you did a good job, right? You covered all the bases. We have a meeting on Wednesday this week with ordinance to consider a zone map amendment on Hamilton Lane, and ordinance to consider regarding a historic design overlay district in the Washington and Lawn Ridge neighborhood, an ordinance that would do a property line vacation for First Community Credit Union, an ordinance that would amend the municipal code regarding the transient lodging tax, and a resolution that would extend the Chrisman Development Agreement, a resolution that would approve the recompete grant. Next thing got moved, and a resolution for the Accident Officer Safety Plan 10+, and a resolution for the Submarine Center funding. And then our next workshop is scheduled to be October 2nd. That's a joint meeting with the Home Builders Association as well as the Housing Advisory Committee Chair to discuss minimum density standards and rezone area identification. Anything, questions regarding those? Dwayne?
Yes, sorry. I brought this up to Valerie, and the Measure 110 letter, whatever we're going to do, I hope we can discuss that here soon, and at least.
Yeah, we did discuss it the other day, and I think Aaron's working on a letter that do you have a timeline for when you're going to present that to us?
I think it was.
Yeah, I was going to present a letter to the mayor and council president for their consideration with regards to support in reworking Measure 110, and probably get it to them this week.
Yeah.
We talked about it last week.
Yeah.
Thank you.
Anything else? Okay. Anything that somebody wanted to get added to the agenda going forward? No? Okay. We will need to talk just to you all individually about public safety levy, a plan for that. It's on the November ballot to renew the levy, so we will be talking about that. And then we have public safety funding again on our November 13th workshop. Dwayne.
Sorry, I can't see when don't have my glasses on. I'm getting old. I would like to have, as soon as the next, when the safety levy is, that we have a fund, is that public safety funding, is that the one right afterwards?
Yes.
Sorry, I can't read it, so I'm like.
Yeah, November 13th.
Okay, as long as we're going to talk about it right afterwards, I think that's a good thing. I've talked to Pell and Dale Grange about it. I think that's a right-away discussion, so thank you.
Yep. Okay, well, who wants to do the honors today? Rick?
I make a
Valerie?
motion. I'll make a motion to adjourn our workshop.
Seconded by Rick. All in favor of adjourning the workshop today, say aye.
Hi.
Any opposed? All right, see you Wednesday evening.